In this video, I explain what causes tennis elbow pain that a majority of providers completely miss and how our providers help fix it without medications or injections that leads to long-lasting pain relief. For those of you who don't know me, my name is Dr. Maggio and I am a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long-lasting pain relief. All right, tennis elbow, let's get right into it. I know sometimes these videos aren't the most entertaining. They're really used to inform anyone that's in pain, that's kind of been, lied to, overpromised, underdelivered by the medical system, and just tired of being in pain. So tennis elbow itself, when I get a diagnosis of it, it really doesn't tell me anything. So I pulled this straight from Google. Tennis elbow lateral epicondylitis is an overuse injury causing pain on the outer elbow due to damage in the forearm tendons, often from repetitive gripping or wrist movements. While it usually heals in a few weeks with rest and ice, recovery can take up to 6 to 12 months. Symptoms include pain radiating to the forearm, hand, weak grip, and tenderness. Treatment involves rest, NSAIDs, physiotherapy, braces, and sometimes injections. So a lot involved there. And when we're looking at tennis elbow, I'm talking about the outside part of the elbow here. It's technically considered your extensor group. That's where you're going to feel most of the pain. And most of these treatments, they don't do anything. Rest and ice, yeah, how's that working out? Yeah, grip's going to be weak. Take some medication, put some braces on it, try some random physical therapy, and hope and pray that it goes away. And when it doesn't get fixed, then hey, you know what? We'll inject you full of a bunch of medicines that only block the pain and don't fix anything. And it's no wonder why this isn't getting any better. This time period of 6 to 12 months is ridiculous too. It shouldn't take this long at all when you're getting a proper diagnosis and the right treatment, which I'm going to be trying to cover in this video. So some regular treatments that they like to use for it: conservative rest, ice, and taking some ibuprofen. Yeah, see how that works. Physical therapy. They do exercises to focus on eccentric strengthening of the forearm. Yeah, that is important, but the problem is we jump into physical therapy way too soon before the tissue is ever healthy. If you're trying to fix a problem with bad tissue by doing exercise, it's actually going to be counterproductive. Support wearing a brace. Yeah, a brace can help. And a lot of times people wear a brace so they can do more. It's not actually fixing the problem. This one I hate: medical intervention, steroid injections, PRP, just wasting money, just randomly inject in a place because it hurts and let's see what happens. Surgery, rarely required, and you really don't want to have surgery on this area. It doesn't do well. A lot of times it's not actually the problem. It's actually the effect of things not working right. Exercises, again, yeah, physical therapy, the go-to is like, hey, go to physical therapy for, 3 times a week for the next 4 weeks, see what happens. Your insurance covers it. Hey, let's see what happens. Doesn't get any better. People are kind of stuck like, hey, what do I do? It continues to get worse. Prevention, this stuff does help, improving your technique, using proper tools, warming up and strengthening the forearm muscles. Definitely can help once you get the tissue healthy. But if you're trying to do all this stuff before the tissue's healthy, you're kind of in a bad place. So what do most people miss about this? Why is it taking so long? Why are these other treatments not working? Because they're missing something so important. So I talk about this all the time. Basically, what happens inside the muscle is the muscle develop this stuff called adhesion, also known as scar tissue. It's like a glue that gets inside the muscle. Repetitive overuse, the muscles don't get enough blood flow. They don't get enough oxygen. They start to lay down this stuff called adhesion. It's like immature collagen fibers that get in there, and it gets inside the muscle, makes it harder for it to stretch and move how it's supposed to. Bad enough, but a lot of times you don't really notice it. Hey, it might be a little tender, a little stiff, nothing too bad. Might be a little more sore after a workout, but nothing where you're like really noticing it until it starts to get bad. Then eventually what happens is it gets stuck to nerves. And when it gets stuck to nerves, it causes a big problem. So this nerve that I'm showing in here is called the radial nerve. It is the biggest nerve of the upper extremity. It basically starts at the base of the neck, goes under the armpit, wraps around the tricep, and goes all the way down into the elbow. And over time, as that adhesion and scar tissue gets bigger, it eventually gets stuck to the nerve and creates a nerve entrapment. And when you have a nerve entrapment, it causes lots of problems because nerves are built with about 15% of like extra slack to keep them moving. But what happens with that adhesion, it starts to form up in the neck, into the shoulder, down through the arm, is everything kind of gets stuck here. So it's causing this area to pull harder. So a lot of people are coming in with lateral elbow pain, thinking it's a tennis elbow, but they didn't actually have like a direct injury there. And a lot of times you need to check higher up in the chain as you go to really get the root of what's going on. when you do have a nerve entrapment, first off, it starts with a little bit of numbness, aching, burning, tension. But then what happens over time is that nerve entrapment gets caught. It causes everything else to alter. Maybe your shoulder might go forward, your arm might go back to try to unload that nerve entrapment. Because when a nerve entrapment happens, it causes your body wants to protect the nerve entrapment before it protects anything else. So people do all these stretches, all these exercises, icing. But the problem is it's not actually getting to the root cause of what the problem is that nerve is getting stuck and it really gets caught in this lateral part of the elbow in through what's called the supinator and then the extensor group as well. Then this is when problems really start to happen. So over time, as the adhesion forms, the nerve entrapment forms, you're still putting force into the body and the force has to go somewhere. So what it does, it actually starts to go to the tendon. And when it goes to the tendon can't handle all that force. So it starts to develop this thing called a tendinosis. Most people think it's called a tendinitis, where they think inflammation. Tendinosis is actually a really bad thing. It actually becomes what's called a degenerative type of thing. And eventually they start to tear as well. Um, Tendinosis is a big, big deal. It causes a lot of problems. What I want to do in the video is actually link up a more detailed video, just a quick little 2-minute video of me explaining what a tendinosis is, how you get it, and the problems it has so you can get a better understanding of what's going on. So I'll link that up right now.
Hello everyone, getting our educational video out. Today I want to talk about the idea and the diagnosis of tendinitis and how it's one of the most common diagnoses out there for injuries in the body, but it's actually incomplete and is actually very uncommon compared to something worse. So what we pulled up here was the Wikipedia page on tendinitis. Basically, tendinitis means inflammation of a tendon. It is a type of tendinopathy often confused with the more common tendinosis, which has similar symptoms but requires a different treatment. That's the key, the different type of treatment. That's very basic, but it means a big deal of a lot of things. So a lot of people are walking around when they have pain in their elbow, wrist, forearm, shoulder, anywhere. They get this diagnosis of what's called tendinitis. Tendinitis just means that it's inflamed. But if it's something that's chronic and been going on for a long time, a lot of those situations are actually isn't inflammation in there. There's actually something a lot worse, an actual degenerative component of the tendon. So when you look at a tendon, normal healthy one basically looks like this. It looks like spaghetti in a box before it's cooked. It's really strong and it would be really hard to snap. That's a normal healthy tendon. But over the years with wear and tear, bad mechanics, injuries, inflammation, everything on that, the tendon really gets beat up because the muscles around there aren't working correctly and it develops what's called a tendinosis. So a tendinosis is, if we look under a microscope, a tendinosis looks like cooked spaghetti. The problem with that is that area of the tendon is very weak. It doesn't get good blood flow, it doesn't get good oxygen, and causes the pain and inflamed type of feeling that you're feeling. What's going on in the current medical model is everyone is addressing tendinosis thinking that it's a tendinitis and they want to get the inflammation down, so they inject it with cortisone. When you do that, that actually speeds up this tendinosis process, makes this tendon even more degenerated, and they're actually showing more and more if you're likely to get a tear or some type of problem, it's because you had a tendinosis first and the cortisone makes that worse. So there's a big difference in the proper type of diagnosis. So if you're walking around with a tendinitis type of diagnosis, you've done multiple injections, and you're still not any better, it might be time to figure out that you actually have something way worse, a tendinosis, and those are more likely to tear. The difference is very important, and the difference is in the details.
So yeah, tendinosis is a really bad thing, and this is when things become really bad. Another messed up thing about this is when you are getting cortisone injections or taking a lot of anti-inflammatories, they can actually make this problem a lot worse, which leads to bigger problems down the road. So yeah, I'm talking all this stuff. I'm saying physical therapy doesn't work, ice doesn't work, injections doesn't work. What actually works? This is how I would address it and how we treat it in our office with our providers, and really see a significant improvement in about 5 treatments or less because we slow down to get the diagnosis right. First thing we do is we go in and we find where that nerve is getting stuck, and we treat it with a very detailed and focused process where we get proper depth, proper tension using our hands, and the client goes through a range of motion that frees up the nerve entrapment. Then we go in and we treat all of the muscles in and around the nerve entrapment, get rid of that adhesion. As we do that, things start functioning better, start moving better, more blood flow, more oxygen in there. Inflammation starts to reduce as well. Then when we get all that cleaned up, we need to go in and actually treat that tendon itself where it's bad with the tendinosis. We go in there and treat that directly. We actually use an instrument when we do that to break down. We almost have to rip some of those bad fibers out of there and create a little bit of inflammation so that it can start to heal. Once we get that tendon healed up and it's functioning better, we actually need to strengthen it. So we do some very focused type of corrective exercises that builds and regenerates that tendon back so it can actually handle more load and more force. But we already did all the work above there by getting rid of all the nerve entrapments, all the adhesion in there. So things are better. So that tendon isn't going to get loaded up as much. Then bracing, we will brace in the short term to help ease the load and force during the treatment process. Like say someone has to work or do something, but we never brace so that you can just do more and do more exercise and do more workouts because that's actually going to be counterproductive from where it goes. So that's all I got in the video. I hope it was helpful. If you're struggling with stuff and you're just tired of getting, kind of jerked around by the medical system, not getting any results, then go click the link in our profile to learn more about our new injury treatment process called the Peak Method that provides long lasting pain relief for chronic elbow pain injuries naturally without the use of medications, injections, or surgeries. Quit having to waste your time at PT doesn't work. Doctors injecting you full of medications that only make things worse. We get to the root cause, we fix it, and we get it functioning so you don't have to deal with it anymore and you get back on to living your life. I appreciate you watching, and I'll catch you on the next one. Bye.